Good day, ma'am. I'm Tran Erickson Estevit po, your attending student nurse for today. So before we begin, may I kindly ask you to state your full name and date of birth po for patient verification purposes?
Cassandra Silog 2, January 2, 2006 po.
Okay, thank you po. So as per the doctor's order, I will be conducting a head-to-toe assessment to help monitor your overall condition po. So for each body system, I'll be using the IPA technique, which stands for inspection, palpation, percussion, and auscultation. So inspection po, it involves visually observing your body po for any noticeable changes. As for the palpation naman po, this will include touching on certain areas to assess for any abnormalities. But please be assured po that this is solely for assessment purposes and you have the right to refuse if you feel uncomfortable. However, refusing may limit the information we can collect po. On the other hand, percussion involves tapping on specific areas to evaluate underlying structures, while auscultation naman po refers to listening to internal body sounds using a stethoscope. With that said, may I ask for your consent po to do so?
Yes po.
By the way, are you comfortable in your current sitting position po ba, or would you prefer to lie down po?
Comfortable po ako sa nakaupo.
So before we begin po, please excuse me for a moment while I sanitize my hands and prepare the environment to ensure your safety, comfort, and privacy.
For the first part, I'll be asking a few questions to assess your level of consciousness. So, once again, could you please tell me your full name, officer? Do you know where you are right now? So, what is the name of the grade you're describing? And the time is 3:40. Can you tell me what we are doing right now? And to process so, as we continue, I'll also be observing how clearly and comparatively as well as your overall mood and physical state. If you're having trouble hearing or feeling confused at any point, which might affect how you observe, please feel free to let me know so I can repeat or clarify the questions for you. Now, I'll be asking you some questions about your health background. So, please answer them as honestly as possible, as your responses will help establish the baseline for evaluating your overall condition. Let's start with one. Do you have any diagnosed medical conditions like diabetes or hypertension? Have you ever been hospitalized or had any surgeries? So, are you currently taking any medications or supplements? Do any of your family members have chronic illnesses like cancer, heart disease, or stroke? Do you have any allergies to food, medications, or substances?
As you proceed with questions about the patient's lifestyle and habits, be observant. Pay close attention for any discrepancies between the patient's responses and their overall appearance, such as posture, hygiene, signs of distress, and nutritional status.
Can you tell me your height and weight po?
165.
Do you smoke or drink alcohol? How would you describe your diet po? Do you exercise regularly? Yes. What kind of physical activity do you do? How often do you bathe or shower po? Every day. Do you have a regular hygiene routine such as brushing your teeth and cleaning? Yes. Alright, the next set of questions is for the review of systems or ROS, which helps identify any symptoms you may be experiencing in different areas of your body. So, they could be answer it as honestly and completely as you can. So, have you experienced any headaches, dizziness, or memory problems lately? have you noticed any changes in your skin like rashes or moles? Do you have any vision or hearing problems? Have you had any sore throat, runny nose, or sinus issues recently? Have you ever experienced chest pains or palpitations? Do you have any difficulty breathing, coffee, or shortness of breath? Have you had any changes in your appetite, bowel movements, or digestion? Have you noticed any problems with urination or reproductive health? Do you have any joint or muscle pains, stiffness, or weakness? Have you experienced unusual weight changes, fatigue, or cold intolerance? I appreciate your cooperation so far, and the information you've shared provides a good baseline for assessing your current health status. And before we proceed, do you have any questions or are you feeling any discomfort? So if not, let's now proceed with checking your vital signs, which include measuring your body temperature, pulse rate, respiratory rate, and your blood pressure. And I will also be assessing your weight level to better understand your current condition.
Assessing the vital signs of the patient will allow the nurse to obtain essential information about the body's current functioning. These measurements help detect any abnormalities and guide appropriate clinical decisions.
Your body temperature given from the auxiliary side is 37 degrees Celsius, which is within the normal range. Your pulse rate is 78 beats per minute. The rate is when the rhythm is regular and the speed is strong. Your respiratory rate is 18 beats per minute, and your beat is normal, the rhythm is regular, and the tap is normal. While your blood pressure is 120 over 80, which is also within the normal range. Now for the last vital sign po, let's assess your pain level using a scale from 0 to 10. 0 meaning you don't feel any pain at all, and 10 being the worst pain you can imagine. So on that scale, how will you rate your current pain po? 0. That's good. So overall, your vital signs are stable and within acceptable limits. So far, do you have any questions or clarifications po? Comfortable? Are you still comfortable with your position? Okay, so if everything is clear, let's now proceed with the physical assessment, starting from the head and face. So first, kindly straighten your head po and sit comfortably. As I expect for exercise, symmetry, or any visible abnormalities. Now po, allow me to palpate it to check for any fastness or tenderness.
I will also assess your hair's texture, distribution, and look for any signs of infestations or scalp conditions. So, please let me know po if you feel any discomfort during this process. Do you feel any pain po ba? Okay. Meanwhile, proceed with assessing facial symmetry and expressions. This allows evaluation of the function of cranial nerve 7. To do this, ask the patient to smile, raise their eyebrows, close their eyes tightly, and then open them up, puff out their cheeks, and display a sad expression. These actions help determine if facial muscles are moving equally and normally on both sides.
So as for the findings on this part of assessment, you're previously that normal muscles of your chest, your scalp is clean, those kinds of infestations, and your hair is able to distribute them. As for your facial symmetry expression, one side of your face moves equally, you are able to perform the previous activities without any difficulty, indicating normal function of the nerves. So we will now proceed with the assessment of the eyes, and do not hesitate to inform me once you feel and pain or discomfort. So I'll be checking several things like the symmetry of your eyebrows and your eyelids to ensure that there's no drooping, as well as the color of your sclera and the iris, size of your pupils and conjunctiva. So to check your conjunctiva po, I'll gently pull down your lower eyelids, and while I'll do that, please look up po. Okay, so the color of your conjunctiva is slightly pink and not with red, which is good naman po. So now, as I assess the size of your both pupils, they both fall under the size of 3, which is a normal size, and they are both equally round. And your eyebrows are a light blue, and there's no signs of swellings on your eyelids.
Now to assess the function of cranial nerve 3, which is the oculomotor, cranial nerve 4 or the trochlear, and cranial nerve 6, known as the obtusans, perform several tests. First is to check for any involuntary eye movements or nystagmus. To do this, use a pen light and hold it about 12 to 14 inches away from the patient's nose. Instruct the patient to keep their head still and follow the movement of the pen light using only their eyes. Then move the pen light through the 6 cardinal fields of gaze and observe if the eye movements are smooth and coordinated. Then, assess how reactive the pupils are to light. To do this, dim the lights slightly and ask the patient to focus on a distant object. This helps the pupil dilate naturally. Shine the pen light into one eye while observing its reaction. The pupil should constrict in response, and the other pupil should also constrict simultaneously. This is known as the pupillary light reflex and consensual response. To check for accommodation, turn the lights back on. Ask the patient to keep their head still and stare at the distant object. This helps dilate the pupils. Then, using the tip of the pen light or your finger, slowly move it inward toward the bridge of the nose. The pupils should constrict and the eyes should converge or cross as they focus on the moving object. To test cranial nerve 2 or the optic nerve, we will perform 2 assessments, the confrontation visual field test and visual acuity using a Snellen chart. First, for peripheral vision, using the confrontation test, ask the patient to stand about an arm's length away, directly facing you, then instruct them to cover their right eye while you cover your left eye. This creates a mirror image. Then ask the patient to focus only on your uncovered eye and not to look at your fingers. Then, slowly bring your fingers into the view from the upper and lower areas of the visual field. Repeat the process for the other eye, switching roles accordingly. Next, for visual acuity, use the Snellen chart. Instruct the patient to stand 20 feet away from the chart, then ask them to cover one eye, first the left, then the right, and read the lowest line they can see clearly. And finally, have them read again using both eyes uncovered. This will help determine the sharpness and clarity of their central vision.
Sa kabilang ay po, hanggang saan naman kayo nababasa ang 8 lines ang pakibasa po? Okay, so both eyes naman po, hanggang saan naman kayo nababasa? 8 lines, pakibasa po.
D, E, F, E, O,
Okay, ma'am. To summarize the findings of the assessment of the eyes, your eye movements were smooth with no involuntary shaking, indicating intact function of cranial nerves 3, 4, and 6. Your pupils reacted equally and appropriately to both lights and near focus, showing normal pupillary response and communication. Your peripheral vision is intact based on the confrontation visual field test, and your visual acuity is trending vertically based on the Snellen chart, meaning your central vision is excellent. Overall, your cranial nerves related to vision and eye movement are functioning well. So far, ma'am, are you still comfortable with your position now? Do you have any concerns with that? Do you feel any pain or discomfort? So if not, let's move on to inspect with your ears now. So I'll start now by checking the external part. I'll now palpate your ear and gently move your tragus. Do you feel anything like that? Then the mastoid process, which is the bony bump behind your ear. Does this hurt you po? Does this hurt po?
No.
I'll now use an otoscope to examine your tympanic membrane po. Wait po. Alright, let's now test the cranial nerve 8 or the vestibulocochlear nerve. And to do this po, kindly cover one ear po. And then I'll whisper something on this side, then please repeat what you hear. Dog, cat.
Dog, cat.
Sa kabilang po.
1, 2.
So, that's good po. Your ear appears symmetrical with no tenderness, deformities, or hearing impairments noted. Okay, so let's now proceed on assessing your nose po. So, using my pen light, allow me to look inside your nostrils to look for any discharge, polyps, or signs of bleeding po. So, kindly tilt your head backward po. So, now we'll do a couple of functional tests. First, I'll check for nasal patency. Please block one nostril po with your finger and breathe through the other po. Then switch sides po. So, have you experienced any difficulty breathing while doing those po? So, lastly, we'll test your sense of smell. So, can you please close your eyes po and try to tell me what's the smell? So everything looks good. Your nose is in the midline, no signs of swelling or bleeding, and your breathing is fine. Your breathing is fine through both nostrils, and your sense of smell is pretty well. Okay, let's move on to the next part. Kindly open your mouth so I can examine your teeth and gums to assess your oral hygiene. To check for any decay. I'll also assess your tongue for its color, moisture, as well as any possible lesions. So moving to your throat, I'll be checking your tonsils. Can you please say or any concern if your uvula is sensitive. So now let's see if your cranial nerve 9 is functional by testing out your back reflex. So I'll just gently touch the back of your throat. That will be with you po. Let us also assess the cranial nerve 12. So to do that, kindly stick out your tongue and move it from side to side. Okay. So evidently, your cranial nerve 10 is intact since you are able to talk and swallow, and everything looks good. The lips, teeth, bones, and tongue appear healthy with no visible issues. So the nostrils are normal, the uvula moves symmetrically, and the gut reflex is present, and the tongue moves properly to the bowl, which indicates normal nerve function. Okay, so before we hado assessment po, do you have any clarifications or concerns? Are you still comfortable pa rin po ba? Do you feel anything po? Okay. So before we proceed, please allow me po to remove my gloves and perform my Now, moving on to the neck, kindly extend your neck a little bit more so I'll be able to check any physical lesions or toxicity.
To test the cranial nerve 11 or the accessory, ask the patient to move his head side to side and up and down. And then ask her to shrug her shoulders against resistance. Follow it with palpation of the trachea to ensure it's on the midline. Then, palpate the lymph nodes too in order to assess for any lumps or hardness. While doing this, watch out for the effect of the patient to know if she's in pain. Moreover, check the carotid pulse and shortly after, listen to it using the bell of the stethoscope. While doing this, ask the patient to breathe in and breathe out and hold it for a while.
So as for the findings po, your neck is symmetrical with no visible lumps. Your trachea po is at the midline, lymph nodes are not swollen, and your head movements are normal. And lastly, your carotid pulse is strong and clear. Now let's move on about to the upper extremities. Can lift without your arms so I can inspect them for any lesions, redness, or springs. So now allow the multiple major radial and brachial pulses. Next, I'll check your capillary refill po by pressing it down on the nail bed of your finger and observing how quickly the color returns. Tingnan po. I'll also assess your skin turgor naman po to evaluate your hydration status. I'll gently pinch the skin on the dorsum of the hand and observe how fast it returns to normal po.
Meanwhile, assess the range of motion of the fingers and hands. Observe the joints for any swelling, deformities, or limitations in movement. Next, assess the muscle strength by asking the patient to squeeze your hands as hard as they can. Then, ask them to push against your hand and lift their arms against resistance.
So lastly po, I'll assess your light touch, sharp, and dull sensation. So you have to close your eyes for this. First, I'll use a piece of cotton to check for neck touch. I will gently tap on different areas of your both arms alternately. So just let me know po when you feel it and tell me if it feels the same on both sides. Same po na naman. Yes. Same po. Yes. be using a 15 cotton swab. One end is blunt and the other is sharp. Again, with your eyes closed po, I'll touch different areas of your arms. Then after each touch, tell me whether you feel sharp or dull. So let's begin the po. You did great po. So as for the findings of this part of the assessment, your radial and brachial pulses are 2 plus bilaterally. Your capillary refill is less than 3 seconds and skin turgor returns quickly, indicating a hydration. Your muscle strength is 5/5, which is normal, and the range of motions of your fingers and hands is full and within normal limits. You were also able to feel and correctly identify both dull and sharp sensations. Okay, now let's proceed na po with the thorax and lung assessment. So for this part po, I ask for your consent and assistance in giving your input so I can properly observe the area. And after that, I'll also be listening to your breath sounds to ensure your lungs are functioning properly.
Inspect the patient for any signs of labored breathing or the use of accessory muscles during respiration. Also, observe the anterior and posterior diameter of the chest to ensure it is within the normal range and that there are no signs of a barrel chest. Ideally, the patient's shirt or hospital gown should be lifted during this part of the assessment to avoid interference with accurate findings. However, for the purpose of this video and to maintain the privacy of the assumed patient, we will not be doing so.
So now, ma'am, we'll proceed with palpating your front and back thorax to assess the tactile nerves. And this involves feeling for vibrations in the lungs. And I'll place my hands on different areas of your chest, and each time I move my hands, please stay next to my mouth.
While performing tactile fremitus, note any changes in the intensity of the vibrations while palpating the chest wall because it can indicate underlying abnormalities. Shortly after, perform percussion on the intercostal spaces, both anteriorly and posteriorly, to assess for any underlying abnormalities such as air, fluid, or solid masses within the lungs.
Your lungs using my stethoscope, and I'll be placing it on different areas of your chest and back. So please breathe in and out through your mouth each time you feel the stethoscope touch your skin.
Auscultate all anterior, posterior, and lateral lung fields. Listen for normal breath sounds such as vesicular, bronchial, and bronchovesicular. And note any abnormal findings like crackles, wheezes, or rhonchi. Cross your arms over your
the thermoscope is equal bilaterally with no decrease or increase in vibration, which means normal. Sa precaution naman po, over the anterior and posterior lung fields, it revealed normal resonance naman po with no areas of dominance or hyperresonance. Sa auscultation naman po, it revealed clear green sounds and all lung fields with no adventitious sounds such as crackles or pieces po. So, no abnormalities or deformities were noted in the thoracic structure, meaning your thorax and lungs are all clean. Okay, ma'am, I will now assess your heart, starting with an inspection of the precordium, which is the area in front of your heart. So, I'll be looking for any visible pulsations po, such as heats or beats that may indicate underlying cardiac issues. So, can you please lie down on the vertical so we can continue the examination? Taba naman po.
Observe the precordium located on the anterior chest wall for any visible pulsations, heaves, or leaps that may suggest cardiac enlargement or abnormal forceful contractions. Next, gently palpate the left side of the chest to locate the apical impulse, also known as the point of maximal impulse or PMI, typically found at the fifth intercostal space along the mid-clavicular line. This helps assess the size, location, and intensity of the heart's contraction. Lastly, auscultate the heart over the 5 key areas, which includes the aortic, pulmonic, Erb's point, tricuspid, and mitral. Listen carefully for the first or the S1 and second or the S2 heart sounds, ensuring they are distinct and regular. Take note of any abnormal findings such as murmurs, gallops, or friction drops.
For your findings po, your heart area appeared symmetrical po with no visible pulsations, heaves, or leaks, and the apical impulse was palpable at the fifth intercostal space, mid-clavicular line, and was of normal amplitude and duration. And your heart sounds naman po were regular with distinct X1 and X2 and no murmurs, gallops, or rocks were heard. So overall, your cardiac assessment findings po were within normal limits. Okay, ma'am. So I'll now assess your abdomen naman po, and I'll begin by looking at the shape and appearance, checking for any bulging, scars, or unusual movements. So kindly take your shirt po and please relax and breathe slowly.
Inspect the contour and symmetry of the abdomen.
Okay, now I'm going to listen to your bowel sounds na po in all 4 areas of your abdomen. So please help us check how active your digestion is.
Check for any visible scars, discolorations, or pulsations that might indicate vascular abnormalities. Listen to all 4 quadrants of the abdomen and note the presence and quality of bowel sounds, typically high-pitched and occurring every 5 minutes.
Are you still comfortable coming back? Okay, so if yes, then everything is your blood vessels in your abdomen. this is to check for any unusual sounds in the arteries that could suggest narrowing or other concerns.
The nurse listens over the aorta, renal, iliac, and femoral arteries for any bruits, which could indicate turbulent blood flow.
Now, ang check the cap of your abdomen naman po to assess the underlying structures and check for any unusual sounds or masses.
The nurse percusses each abdominal quadrant, noting tympani over hollow areas and dullness over solid organs or fluid-filled areas.
So, lastly po, I'll be filling your abdomen gently at first, then a bit deeper. So, please let me know po if anything feels tender or uncomfortable.
The nurse performs light and deep palpation in all four quadrants, observing for any guarding, tenderness, or palpable masses.
So, everything looks normal naman po in your abdominal area. The shape and contour are symmetrical and I didn't observe any unusual movements or scars or swellings po. So, I heard active bowel sounds in all four quadrants, which is a good sign that your digestion is working well. There were no abnormal sounds in your abdominal arteries and the percussion sounds were what we expect, mostly hollow, which is normal. And lastly, when I press in your abdomen po, I didn't feel any unusual bumps. So, everything is within normal limits naman po. Okay, let's now proceed with the assessment of your lower extremities. I'll begin by inspecting the color, shape, and size of your legs and feet, along with the hair distribution, which can give us information about your circulation po. So, for this part po, I need you to leave your hands tightly.
Inspect both lower extremities for uniform color, swelling or edema, equal size, and hair distribution that may reflect peripheral circulation. Then, proceed to palpate the dorsalis pedis and posterior tibial pulses bilaterally, assessing their presence, strength, and symmetry. Moreover, check the capillary refill and temperature of the lower extremities to evaluate circulation and perfusion.
So now, let's check for the sensation in your lower extremities naman po using this broken compass rod, just like what we did earlier with your thumbs po. So please close your eyes po and let me know if you feel a sharp or a dull sensation po. Up. Up.
To assess the range of motion in the lower extremities, begin with a few exercises. First, place one hand on the patient's scalp and the other under the mid-thigh. Then lift the leg upward 3 times. Then gently move the leg out to the side and back, followed by performing hip rotations. For the knee, position one hand beneath the knee and the other under the heel to prevent dragging. Then gently lift the leg 3 times to assess movement and strength. Next, support the heel to assess the ankle. Perform plantar flexion. Move the foot side to side. And finish with gentle ankle rotations. Now, to assess the muscle strength of your lower extremities, ask the patient to lift her feet as you put resistance. And then ask her to sit and bend her knee against your resistance. The nurse assesses bilateral muscle strength and joint mobility in hips, knees, and ankles, ensuring both strengths and full range of motion are symmetrical. The patient performs tandem walking, which evaluates coordination, strength, and gait balance.
So, both of your legs and feet appear symmetrical in color, size, and shape with normal ear distribution. Your pulses naman po, the dorsalis, pedis, and posterior tibial were strong and equal bilaterally. Your vocabulary field was under 2 seconds and temperature was warm. Sensation was intact with accurate identification of short and long sleep time. Muscle strength was 5/5 and full range of motion was observed in hips, knees, and ankles. So the patient demonstrated good balance naman po and coordination during two-to-two walking. Okay, ma'am, so I'm asking for your cooperation once again as we move on to assess your neurological and musculoskeletal function. So to start po, please stand up and walk a few steps across the room po at your normal pace. Then return. This will help you observe your natural gait, balance, and coordination. Unlike the two-to-two walking here po, this time we just walk normally. Please raise your arms and push and pull against my hand as I provide some resistance po. Then, please let me know po if you feel any pain or weakness.
Observe the patient's ability to perform cross-motor movements smoothly and symmetrically. Assess muscle strength by applying gentle resistance and noting any weakness or asymmetry. Proceed on assessing the patient's fine motor coordination. Instruct the patient to extend one arm and using their index finger, alternately touch the tip of their own nose and then your finger. Slowly move their finger in different directions to observe the accuracy, smoothness, and control of the patient's movements. The procedure should be repeated several times with each hand to compare both sides and ensure consistency in coordination. Since Kate was already tested a couple of times in the previous assessment, just keep observing the posture, noting any signs of imbalance, asymmetry, or abnormal movements while the patient is standing or walking normally. Ask the patient to stand on one foot for a few seconds, then ask her to gently bend her knee. Then tell the patient to inform you if she felt unsteadiness at any point or any difficulties. Pay attention to how the patient holds their body, whether there's any slouching, leaning, or favoring of one side. Subtle cues in posture can provide additional insights into musculoskeletal and neurological issues that may not be evident during gait testing alone.
So, as for the findings po ng neurological and musculoskeletal assessment niyo po, you demonstrated normal gait walk, posture, and balance with no signs of asymmetry or stability. Gross and fine motor functions were intact, movements were smooth, coordinated, and symmetrical. Then, your muscle strength was equal bilaterally, and no pain, weakness, or discomfort was reported. Then, for the deep tendon reflexes, they are within normal limits din po. And overall, your neurological and musculoskeletal functions are normal. Then, based on the overall findings po ng head-to-toe assessment nyo, there were no abnormalities noted and everything appears to be in normal limits po. However, I will still report this and communicate these findings to your attending physician. So, please wait for further instructions before we conclude. Do you have any concerns or questions po ba? Are you feeling any tenderness or discomfort po? Are you comfortable in your current position ba? So, if everything is alright, that completes our assessment. Thank you very much for your cooperation po.